Hi everyone, I'm Eric from Delos Therapy and this is Gina from A Sweat Life. We will be talking about tech neck today, and it's one of the more common things I definitely see in the clinic where people are sitting at a computer all day, using a mouse, hunched over, and their muscles behind the scapula and the traps and neck all just become rounded and tight. It's definitely the most common thing I see on a daily basis. So how do you get rid of it? You can definitely come in and see us. We also have a couple of tools here so you can self-treat. We call that delosing yourself. So let's get into it a little bit, Gina. So what you want to do is any area that you're noticing that's having sort of that dull ache that you're feeling when you're at a computer and you're hunched over, pick that area and apply direct pressure into it. It's kind of a hard area to get to, so that's why the Thera Cane is pretty useful. So using it the right way. So let me show you a quick trick here, Gina. So actually coming across is useful, and you want to pull down with the top handle and push out, and that creates leverage. That's actually a much easier way. I can show you from the side. So all I'm doing is I'm actually controlling the pressure with this. I'm just pushing out and pulling down. So let's try that.
Okay, on it.
Because you want it to be done easily. The more effort it takes.
Oh, that's different.
Yeah, the harder it is. So if it's very easy, it's something that you can do for 10 or 15 minutes while you're sitting at home. So you have to think about the muscles of the scapula. So typically the rhomboids major, rhomboids minor. So you want to get right next to the vertebrae, and you want to go right down the center of the vertebrae, never touching the vertebrae or the spine, and then working your way out laterally towards the scapula. So just kind of think about drawing a box right at the top of the scapula and the bottom of the scapula and just zigzagging back and forth in between there.
So I'm working on that now, drawing my grid.
Yep, 2 to 3 seconds per press. So press directly in 2 or 3 seconds, hold it, come out, go to the next spot, press in for 2 or 3 seconds, hold it, come out, go to the next spot. So really, really important to have static pressure. Pressure focused into one spot. So let's show them what dynamic pressure or pressure and moving around. So I see a lot of this. Let me grab this 1 second. So I'll see, a lot of times I'll see people kind of going like this or like this. That will not be effective. And in fact, if you're pressing hard enough and you're moving it around, it'll damage the tissue and you'll feel worse.
Oof.
So I commonly see that. So remember, you want to focus the pressure directly into the spot that you're treating.
Okay, so right now we're working on the shoulders, the back. What other areas are tight when you're working on?
So definitely when you get all through the scapula, after that you want to get through the top of the shoulder, so the trapezius muscle.
Mm-hmm.
So then you would bring it forward a little bit. Exactly, yep. And you can start right where the neck and the trapezius meet and go right down the center of the top portion of the trap.
All right.
So hold pressure, yep. You want to pull directly down, hold pressure for a couple of seconds, and then move out to the other side.
Oh, boy.
It will feel tender.
Yeah, this is tight for me for sure.
Yeah.
But I'm a desk person.
So it should have that hurt so good feeling to it. Remember, the pain should never be out of proportion. If it feels extremely tender, it's a very light pressure. Definitely have it evaluated. And if it feels hard and it feels tender, those are typically the areas that need more work. Mm-hmm. And again, this area right here is probably the most common thing that I see clinically. So as all of these muscles all through the upper back and the trap, and even in the front of the chest, as they all get tighter and tighter, you can see that it will round you forward and affect your posture. What I commonly hear is, oh, I'm just trying to hold my shoulders back. But think about it. If all of these muscles are tight 24 hours a day, holding and rounding you forward, there's no amount of holding your shoulders back that can counteract that. Removing the force that's rounding you forward in the first place is a much better solution, because then you don't have to hold your shoulders back. You shouldn't have to hold them back. They should just go back automatically. I'm not saying there isn't an active component to good posture, but it shouldn't be work. They should just go back naturally. And when you loosen all of this up, what you'll find is your shoulders will square out and they will hold back naturally.
So if I wanted to add a little something extra to this, I could tilt my neck.
Great idea, Gina. What do we call that?
A pre-stretch.
A pre-stretch. She's a veteran at this. So what she's doing is she's actually stretching all of this muscle tissue lengthwise, bringing the tightness, the deeper fibers that are really, really tight, bringing them to the surface. So that gives you access to the tighter fiber so that you can apply direct pressure and break up that tightness. So she's stretching it in 2 planes. She's stretching lengthwise and stretching individual muscle fibers with pressure. It's a really great way to stretch a muscle.
So if you don't have a Thera Cane at home, you can get one on Amazon or wherever you do your online everything store shopping, just Amazon. Yeah. But it's great for TV viewing or life living and still working your muscles, because you can manipulate these muscles with a lacrosse ball, but it's harder, right?
A little bit harder, yeah. So you want to get all through the scapula, get all through the trap, and then slowly work your way up through the neck, keeping that pre-stretch. And then eventually what we'll do is when you get through both sides, we'll teach you how to use a lacrosse ball on the back when standing up against the wall. But you can actually use the Thera Cane up against the wall. Anything that you can use to provide leverage, to apply more pressure into that area, will be effective. And I like what you were doing, Gina, there. So sometimes just moving it around a little bit, what you'll find is you'll orient the tightness patterns in the exact location that you need. So it's all about finding the exact patterns of tightness. Remember, muscles are three-dimensional, tightness patterns are three-dimensional, so you can't just apply pressure randomly. I mean, you can, but then you won't get great results. What's important is to figure out exactly where you're tight, orient those fibers, bring them to the surface so that you can apply pressure and break it up.
Oh boy, okay. Works that neck.
A little bit on the other side just to see how it feels. So important, always do both sides. Right? Remember, posture is bilateral.
Ooh, this side is different.
Yeah, what you'll definitely notice is one side is typically more tender than the other. So just like you have a dominant side, just like you have a stronger side, everybody has a tighter side. So it's something that I commonly see clinically is one shoulder will hurt, one knee, one hip. It's rarely bilateral. It's rarely both sides. Now, the natural progression, I would say, is it will start on one side. As this side tightens up and locks up and your body begins to compensate and use the other side, the progression the pain will go from one side to both. So that's something I commonly see, but it rarely just starts on both sides. Oh. So that's why we treat both sides, is that when it starts on one, we're being proactive on the other side to make sure that both sides are healthy.
Mm-hmm. This feels great. This side is definitely tighter for me. I'm right dominant. Would that have anything to do with it?
It could. What I've noticed is that it does not correspond to handedness. I can't tell you how often I have right-handed patients and their left shoulder, their left hip is the tighter one. I've experienced that. I'm right-handed. My left hip is something that I have to maintain a little bit more.
Oh, that's a spot.
So a lot of it's genetic, just like you have a tighter side, or sorry, a dominant side. So a lot of it's genetic, it's neurological. But typically one side of the body will be tighter than the other. So good. All right, so now we'll move to the trap.
Oh, the fun part.
And I would spend more time on the side that does hurt. So if you have one side that feels a little bit more achy, a little bit tighter than the other, definitely spend more time on that side, but maybe a quick pass through the side that's asymptomatic, that doesn't hurt.
I'm in that pre-stretch again just because it felt so good.
And while you're doing it, so Gina's doing a great job of really hitting each individual muscle fiber. So you want to do your best to have an organized approach. So going down the central portion of a muscle, the front of the muscle, the back of the muscle, rather than just applying pressure randomly, really try to have some type of a systematic, organized approach so that you're treating the entire muscle, and always be thinking in 3 dimensions. So muscles are 3-dimensional, and they need to be hit from multiple angles.
Ooh. So if you find somewhere that just really is tender, should you spend more time on it or keep going with that same organized approach?
I would say, great question. I'd say the first pass, you want to treat everything to sort of get a general layout of what's the architecture of this muscle. Where are the areas that are tight? Where are the areas that are healthy and loose and don't need as much time? So if you get stuck on one spot, you might miss a lot of other areas that also need time and attention. So I would say the very first pass, go through everything, and in your mind, map out the areas that feel a little bit more tender and a little bit more tight. Go back to those areas for a second or a third pass and spend a little bit more time there. So great question.
That feels better already.
Good. It looks like it's got a lot of blood flow, so what you should feel is it'll feel warm, it might feel a little bit red from the pressure, it should feel lighter, looser. Those are the signs and symptoms that you're looking for.
Excellent. Should we move to the wall?
Let's do it. All right, so now we're going to keep working on the back and the shoulders, so we're going to use the wall now and a lacrosse ball. So we moved on from the Thera Cane. So what's beneficial about this is you can lean up against the wall, and we can do what's called a pre-stretch. So with the rhomboids and all of the muscle tissue behind the scapula, the Thera Cane is really great, but it's difficult to get some of the deeper fibers. So what's really wonderful about this position is you can stretch everything in that scapula out and then dig in with the lacrosse ball. Ooh. So how is that feeling?
This feels so good.
So what's really important here is making sure that you're not rolling up and down. So I've definitely seen patients where they're moving their body up and down kind of like this, and they're rolling along the tissue. You do not want to roll along the tissue. That's just moving across the surface. Keep focused pressure. So 1 point, hold pressure 2 or 3 seconds, come out of it. It's okay to roll between points or move the lacrosse ball like you're doing, but more importantly, it's important to focus the pressure into one spot, move it to the next spot, hold pressure, and keep that progression up and down.
What I love about this too is it gets into the back of my shoulders, a place that I often just feel super tight, no matter how I'm working, whether I'm standing or sitting. These just bad boys get really tight.
Yeah, this is probably the most common area I see in addition to low back. I would say, people just sitting at a desk all day and they're hunched over. So really, really important to keep these muscles pliable. And a lot of people are stretching these areas out, so they're just kind of doing stretches like this and moving their neck around. And all of that's great for the pliable muscle tissue, but it's not doing anything to break up that tightness. So the tightness is what's making you symptomatic. That rock hard muscle, that will round your shoulders forward. That'll affect your posture. It'll cause pain. It'll cause stiffness. All of those fibers have to be broken up. I cannot think of a more effective way to break them up than applying pressure directly into them.
And if these are super tight, one can experience headaches, right?
Yeah, for sure. All of the muscles behind the shoulder blades, up into the back, up into the neck, they all attach at the base of the skull. So you can imagine as they're shortening and tightening, they're applying pressure right at the base of the skull. And posterior headaches are very common. And a lot of times it's actually coming from the back of the shoulders or the upper back that's exerting a force on the back of the head, and that's what's causing the headache. If you've been diagnosed with a tension migraine or a tension headache, it's almost guaranteed that it's coming from the upper back. So loosening of that will help. And if you have a history of tension migraines, it's something that we can definitely help you out with. You can do a lot of good by self-treating, keeping the muscles at the top of the back loose and pliable. And if you're feeling a tension migraine or feeling tightness up there, just slowly work back and forth as high as you can up into the neck.
Okay, so I worked in a grid all along this side. Should we do the other side?
You should definitely do both sides. So just because one side hurts doesn't mean the other side gets neglected.
Let's make it hurt so good. So just like before, my arms across my chest.
So what she's doing is she's stretching all of the muscle tissue behind the scapula lengthwise, bringing the deeper fibers to the surface so that we can apply pressure and force a stretch with pressure. So she's stretching twice. Very, very important.
Stretch so nice, you did it twice.
So how does that feel?
This feels great. This is honestly the most refreshing stretch I've done in a while because it's exactly what I needed in my back and my shoulder.
Yeah, it should feel good. Something that I commonly hear is that it hurts so good. So if you don't feel much, you're probably doing more of a compression. So it's actually not stretching apart enough muscle fibers at the location of the pressure. But if it is so concentrated that it's very sharp and it hurts too much, then that can be more aggravating. So you have to figure out the right amount of pressure. There has to be enough pressure to change structure. Very, very important to change structure, but not so much pressure that you're guarding against the work. If you're contracting because it hurts, then you're actually preventing the tissue from loosening.
Ooh. So I'm moving a little bit from spot to spot. It's okay if I roll to that next spot, or is it better if I just pick it up and move it?
It's okay to roll between spots, but make sure you come out of the muscle tissue when you're rolling. You don't want to roll with heavy pressure. That will be more aggravating than anything. So really, if you think about the mechanics of what you're doing, is you're stretching with pressure. So you're going directly into a muscle, you're forcing it to stretch, and you don't want to roll while that pressure is engaged. So you have to come out of it, then you can roll to the next spot. So I see a lot of patients rolling their IT bands or their upper back, and they're using heavy pressure and they're using motion, and they come into the clinic feeling much, much worse.
Yeah, I am very happy that I'm doing this video with you today because I needed all of this.
Yeah, this is a great way to maintain pliability on your own and keep your body healthy. And this will affect your posture, it'll affect your energy levels, it'll affect your workouts, you'll feel stronger, you'll feel better. You have to keep your muscles loose.
So for us desk dwellers, how frequently should we be doing this sort of routine? Neck, rhomboids, shoulders?
Yeah, so very important question. I would say first thing is change positions when you're at work. So if you're sitting, if you're working for 8 hours, try a standing desk, try a sitting desk, try sitting on a ball, getting up, walking around. It's very important not to stay in one position for too long. So if that's an hour, hour and a half, and then you can work standing up, that's great. Changing positions will definitely help. If you've been sitting at a desk for hours on end, year after year, and you're already tight, you have to restore pliability first. So changing positions will not undo the damage that's been done. Once the damage has been done, you will need a decent amount of therapy to loosen it up. So a couple times a week I think would be good. If you're more predisposed to getting tight, if you feel tight on a daily basis, you probably need to do a little bit of this therapy, 5-10 minutes on a daily basis. Once you start to feel pretty good and you don't feel stiff and you feel like your posture is straight, I'd say weekly at the least.
Get a Thera Cane for your desk.
Yeah, it'll definitely help you feel better, and then you will avoid any more serious injuries as a result of that loss of pliability.
Here's to no tech necks.
No tech neck.